For decades, the whole conversation around healthcare in America has been framed as this huge political fight, a moral debate, right? But what if we just stripped all of that away? What if we looked at it as a simple question of system design, of pure logic? So let's do that. Let's tune out the noise and just analyze the design.
Because really, this isn't about left versus right. We're not going to get into the usual partisan arguments you always hear. Instead, we're going to treat this like an engineering problem.
Because that's really what it all boils down to. When you look at the data, it points to a pretty clear conclusion. A universal, simplified system is just the most efficient and cost-effective model. This isn't about feelings or politics, it's about performance.
And that idea of performance brings us right to the heart of the problem we need to solve. This massive disconnect between what the United States spends on healthcare and the results it actually gets. Okay, let's start with a number. In 2023, the U.S. spent $13,493 on healthcare for every single person. Now look, that number might not mean a whole lot on its own
Until you see it like this. That $13,000+, it isn't just a little high, it's nearly double what other developed countries like Germany, Canada, or the UK spend. I mean, we are a massive outlier. We're paying way, way more than anyone else. So the big question is, what are we getting for all that extra cash?
Well, the answer is kind of shocking. We're getting less. Despite spending twice as much, the U.S. consistently ranks last among its peers on the things that actually matter. We have lower life expectancy, more deaths from preventable causes, and a bigger burden from chronic diseases. So think about that. We are paying a premium, top-shelf price for a product that consistently underperforms. That's the paradox.
So, if a lack of money isn't the problem, what is? To figure that out, we have to kind of pop the hood on the system itself and find out where all that money is actually going. And here it is. This is the core issue. A huge slice of our healthcare spending, we're talking up to 30%, never even reaches a doctor or helps a patient. It just gets eaten up by administrative waste. That's money spent on paperwork, on billing, on insurance company overhead, not on making people healthy.
And here's why that waste is there. On the left, you've got the U.S. system, this incredibly complex patchwork of private insurers, government programs, middlemen, all with their own rules and their own paperwork. And on the right, you have the alternative, a single, unified system with one simple way to pay. The complexity itself is what's so expensive.
The numbers on this are just crystal clear. Private insurance companies in the U.S. spend between 12 and 18% of their money just on overhead. Now, compare that to our own Medicare system, which runs on about 2%, or Canada's single-payer system at around 3%. It's just built in. The fragmented private model is structurally, fundamentally less efficient.
Okay, so if that's the problem, what's the solution? Well, if we keep treating this as an engineering challenge, the goal isn't to win a political argument. It's just to find the most efficient design. And the principles for that, they're pretty universal. In any system, it doesn't matter if it's a car engine or a healthcare network, there's this concept called entropy. It's basically the friction, the baseline level of waste that you can never, ever get rid of. No system is ever going to be 100% efficient. But here's the key. The goal isn't to build a perfect zero-waste system. That's impossible. The goal is to eliminate all the avoidable waste. And the thing about the U.S. system is how much of that avoidable waste it keeps by its very design.
So how does a unified system get rid of that waste? It's a pretty logical four-step process. First, you unify all the payments, which gets rid of thousands of redundant billing departments. Second, you centralize price negotiation. I mean, imagine the bargaining power you have to lower costs. Third, doing those first two things naturally streamlines all the administration. And finally, the whole system can shift its focus to preventive care, which stops those expensive emergencies before they even happen.
And all this brings us to one final clarifying question. When you look at all the evidence, the higher costs, the worse outcomes, the massive avoidable waste, if what we really want is a system that costs less and works better, what's the only choice that actually makes sense?
And that really leads to the ultimate conclusion here. The case for universal healthcare, it isn't really about morals or politics at its core. Fundamentally, it's a logical one, based on the simple principles of efficiency, simplicity, and scale.